It often begins silently, almost invisibly. A girl wakes up one morning and thinks her period is just a little delayed. She assumes it's due to stress. The next month, it comes late again, then again, and slowly, a tiny doubt starts forming in her mind. She brushes it away, telling herself she is fine. After all, everyone says irregular periods are normal at this age. But the truth is far from normal, because in that delay lies the beginning of a condition that affects millions of women. A condition that hides behind symptoms so ordinary that most women ignore them until the story becomes serious. The suspense begins the moment the body whispers its first warning, long before PCOS becomes a diagnosis. I'm Dr. Ayurmoolam, and today we are entering a world where early signs matter more than anything. PCOS is not a sudden illness. It is a slow puzzle, a hidden mystery, a condition that develops quietly over years while women keep adjusting to their symptoms, thinking everything is fine. This topic matters because early detection changes everything. Fertility outcomes, hormonal balance, emotional stability, skin health, hair health, weight, energy, and long-term metabolic conditions. When women recognize the early signs, they can reverse the condition before it becomes a lifelong struggle. But when those signs are ignored, PCOS becomes a powerful force that reshapes health gradually and silently. Imagine a young woman in her 20s. She smiles brightly, attends college or work, hangs out with friends, lives a normal life. But behind the smile, something feels off. Her periods have become unpredictable. Her skin is breaking out more than before. Her hair is thinning. She feels tired without reason. She gains weight even when she doesn't eat much. She assumes it's stress or lifestyle or just a bad month. But the truth is, her hormones are shifting. Her ovaries are responding. Her insulin levels are rising. And signs of PCOS are quietly forming a pattern long before she becomes aware of it. Symptoms of early PCOS show up in many ways. Some notice increasing acne, especially on the jawline. Some see darkening of the neck or underarms. Some feel bloated often. Some experience hair loss or thinning. Some develop unwanted facial hair. Some feel unusually fatigued. Some feel their mood fluctuating more than usual. And the most common early sign is irregular periods. Doctors observe hormonal imbalance indicators, increased androgen levels, low ovulation frequency, insulin resistance. Many women don't take these signs seriously because they come gradually. But PCOS rarely appears with a big announcement. It begins with whispers. The real suspense unfolds when we understand why PCOS starts. Medical science reveals that PCOS is rooted in a combination of insulin resistance, hormonal imbalance, and inflammation. Insulin, the hormone that controls blood sugar, becomes less effective. When insulin rises, it pushes the ovaries to produce more male hormones called androgens. High androgens disrupt ovulation. No ovulation means irregular periods, and high androgen levels cause acne, hair growth, and hair fall. Another piece of the puzzle is chronic low-grade inflammation. Women with PCOS often have higher inflammatory markers, which worsen weight gain and hormonal imbalance. Ayurveda offers a deeper explanation. It describes PCOS as a disorder of kapha dominance, heaviness, stagnation, accumulation, combined with vata imbalance, which disrupts the menstrual cycle. Agni, the digestive fire, becomes weak. Ama, the toxins, accumulate. Channels carrying reproductive hormones become blocked. Ovaries accumulate cystic follicles. Metabolism slows down. Stress increases vata. Poor diet increases kapha. Together, they create the perfect environment for PCOS to develop quietly. The body warns through irregular periods, weight changes, skin issues, and emotional imbalance. But the warning is often ignored. Women often ask why these symptoms appear so early. The answer is simple: modern lifestyle, high sugar intake, processed food, emotional stress, long working hours, irregular sleep, sedentary habits, genetics, and hormonal disruptors from cosmetics and plastics. All these factors create insulin resistance and hormonal chaos. PCOS is not a sudden attack. It is a slow storm forming over years. Diagnosis of early PCOS requires attention to detail. Doctors begin with a conversation, understanding period history, symptoms, weight changes, emotional tendencies, and lifestyle patterns. Blood tests include follicle-stimulating hormone, FSH, luteinizing hormone, LH, testosterone, prolactin, thyroid levels, fasting insulin, and AMH. Ultrasound checks ovarian appearance, follicle count, and hormonal response. Ayurveda diagnosis evaluates digestion quality, bowel patterns, stress levels, sleep rhythm, and dosha imbalance. Women should consult a doctor when cycles become irregular, acne worsens unexpectedly, hair fall increases, weight changes rapidly, or dark patches appear on the neck or underarms. Treatment begins with diet because food shapes hormones more than people realize. A PCOS-friendly diet reduces sugar, processed foods, deep-fried items, and refined carbs. Include high-fiber foods like vegetables, fruits, oats, and millets. Add protein to each meal to stabilize insulin. Include good fats like nuts, seeds, ghee, and olive oil. Cinnamon, fenugreek, turmeric, and flax seeds support hormonal balance. Ayurveda suggests warm, cooked meals to support digestion and avoid cold, heavy foods that increase kapha. Hydration is essential because toxins are removed through water. Avoid eating large meals late at night because it slows metabolism and increases insulin resistance. Exercise is non-negotiable for PCOS. Movement improves insulin sensitivity. Walking, strength training, yoga, Pilates, and cycling help regulate hormones. Strength training builds muscle, which burns glucose more efficiently. Yoga reduces stress, which reduces androgens. Surya Namaskar improves metabolism. Deep breathing supports hormonal stability. Women should avoid long gaps without movement because prolonged sitting worsens PCOS. Medicines and supplements help depending on the cause. If insulin resistance is significant, metformin may be used. For women trying to regulate periods, hormonal therapy may be given. In Ayurveda, herbs like ashwagandha, shatavari, gokshura, cinnamon, and fenugreek support hormonal balance and digestion. Supplements like vitamin D, omega-3, magnesium, and myo-inositol support ovulation and improve insulin sensitivity. However, supplements must be selected based on symptoms and medical guidance. Lifestyle and Ayurveda principles complete the treatment. Sleep is vital because hormonal repair occurs at night. Waking up late disrupts the circadian rhythm and worsens PCOS. Women must sleep before 11 p.m. Stress management is essential because cortisol imbalance increases androgens. Reduce screen time at night. Avoid multitasking. Take breaks. Practice mindfulness. Ayurveda recommends abhyanga, warm oil massage to balance vata. Eating meals at the same time daily improves digestion. Avoid cold drinks. Drink jeera, coriander, fennel water daily. Reduce emotional load. Avoid comparing your body to others. PCOS responds strongly to emotional healing, too. A simple list of do's and don'ts helps women act immediately. Do follow a consistent routine. Do include protein in each meal. Do exercise daily. Do sleep early. Do manage stress. Don't consume excessive sugar. Don't binge eat. Don't skip meals. Don't stay sedentary for long. Don't ignore early signs. Don't self-medicate. Prevention and long-term care depend on stability. Stable meals, stable sleep, stable movement, stable emotions. Begin the day with warm water. Eat a nourishing breakfast. Move every 2 hours. Practice yoga. Keep the gut healthy. Avoid toxins from processed food. Support hormonal balance with regular routines. When women build long-term habits, PCOS reverses significantly in the early stages. Now imagine the young woman again. When she finally understands her symptoms and their meaning, she feels a mix of relief and regret. Relief because she now has answers. Regret because she ignored the signs for so long. But as she begins her diet changes, exercise routine, sleep correction, and emotional care, her symptoms slowly fade. Her periods become regular, her acne reduces, her hair strengthens, her energy rises, and her confidence returns. The mystery of PCOS begins long before diagnosis, but the solution begins the moment a woman chooses awareness. If this explanation helped you understand your body better, like the video, share it with someone who needs this knowledge, and subscribe to Dr. Ayurmoolam for more medically clear and women-centered health guidance.